What happens when compassion meets computation? Can artificial intelligence not only optimize businesses, but also care for our aging loved ones? Welcome to XTraw AI, where we dig deep into how AI is transforming our world, one breakthrough at a time. I'm your host, Raghu Banda, and today's episode touches on something profoundly human: the art of caring, powered by the science of AI. Joining me today is Ravi Joseph Kota, the visionary founder and CEO of AITCare, a startup that's leveraging artificial intelligence to improve elderly care with safety first solutions. Through smart cues, visual, auditory, and verbal, AITCare is working to prevent memory loss, reduce falls, and help seniors live more independently. Ravi's work is a shining example of purpose driven innovation, and I can't wait to explore how AI is being used not just for efficiency, but for empathy. Ravi, welcome to XTraw AI. So glad to have you here.
Welcome back to our Extra AI podcast series. And today we are going to talk about an interesting topic about we all know about elder care and how there's a lot of we are all going through some transitional phase, and so how we can take care of this elder care aspects of it. And so we are bringing a topic about how AI can help in this aspect, empowering elder care with AIT Care. And I have with me the CEO and founder of AIT Care, Mr. Ravi Joseph Kota. Ravi, do you want to give a quick background about yourself?
Yeah. Thank you, Raghu, first of all, for inviting me to this one. This is a wonderful event. I born and grew up in the southern India, this place called Vizag. That's where I did my schooling and everything.
Mm-hmm.
And I started my career with IBM, and I moved to States in 2010. So that's my the childhood days and then education.
So I know great that I think you're coming from South India as well. So my first question, I think I start with some kind of a teaser question about your professional background and what led you to the field of AI, particularly in healthcare. I know this is a very hot topic, AI and generative AI. Healthcare is one particular aspect or one particular domain where a lot of help is needed, or a lot of services can be built. And how did you get here? Like, how did you transition getting into this kind of a healthcare with AI kind of a background?
Yeah. Thanks for the question. So, as I mentioned, I did my bachelor's in computer science from the state of Andhra Pradesh. So, in the mid 2000s, I started my first project actually in a startup company was the healthcare project, which is per se. We call it AITCare now. Those days, actually, the alternate another name is per se. We learned a lot about healthcare, how the US healthcare system works. Pretty much most of the things, HIPAA things to HIPAA transactional codes to the billing and everything, et cetera, et cetera. So, and then when I moved to the States in 2010, and I have seen a lot of elderly people are having, they're in much need of the services like feeding, bathing, change of clothes, the transportation, shopping, etc. So I'm a Christian. I grew up as a Christian. So I go to churches in the northeastern states like New York, New Jersey, Michigan. In those states, mostly you will see older people.
Right.
So I have seen, I used to serve at the churches, like audio video engineer, usher, or whatever role that fits in that the church needs. I used to serve there. So you'll have to interact with the people, most of the time at some point at least, right?
Right.
So the older people are coming more, so you'll have to interact with them. They'll also interact with you. So the shocking thing, what happened was to me, the people are slowly forgetting my name. They're forgetting me completely. Sometimes they come and ask the same question. We visited, Pastor and I, we visited one of the older adult place home. Is a member of the church. So she was kept asking one question that would you like to have a coffee?
Mm-hmm.
That question came within 10 minutes time. She asked maybe 20, 30 times. For every few seconds, just kept forgetting and then asking this question. So that was actually, pastor told me that, oh, this woman, this church member has this problem called dementia. So they'll have a frequent forgetfulness. And I have seen more and more needs, like older people have a cuts, bruises on their skin, different, we have been seeing all of those issues. That's when actually I realized they're in much need. They're not close to their families. They don't have anyone who's living with them to take care of them. They're living individually, alone at their places. So that's why they are going through these accidents, memory losses, isolations thing. That's when we started. I was thinking about helping these people. I used to help with this computers and all this stuff.
Right.
But this is way beyond what I used to do, right? So that we choose that while I was doing the research, I figured out the AI is something that can help the older people. But many ways, not be 100% solutions AI can provide or any other technology can provide, but majority of the problems can be solved with AI. So I'm a big fan of Indian mythological movies. I don't know how familiar you are with those movies. I really like, doors automatically opening, things are coming out, seeing people from the remote. Everything is, most of things are, happening now, like, video call, how we are doing right now. Um, I was thinking like, why can't we do something like that using AI? That was actually started in 2014. That's when actually it came. And then from 2016, 17, focusing on the AI, how AI can help people, what AI can do, what capable of AI. So all of those areas. And the other question you asked me, how AI and fits into the AI healthcare, especially in elderly care side, right? Yes, AI is the best solution that we have today, which is actually helps, taking our sick care to the preventative care or proper healthcare systems. How it can do is, by monitoring systems are much, feasible. AI has a very good, senses compared to the human. I don't know if you believe in that. It can have a better vision without even taking a blink of an eye. Can continuously watch the person activities. And the same thing with auditory. It can listen better, listening skills, better communication skills as well. But it has better speaking skills than the human too. So if we can combine all of this, you'll be providing the solutions for preventative care. You can bring up this preventative care.
Beautiful.
So the problem is, it's a growing problem. The growth in the problem is much higher. If you see, 7 people are assisting one elderly person in the family caregiving side, and that's the number. So which means they're sacrificing their personal time, 2 to 3 hours of time for their family member. But what if you have 2 people inside in the home, 2 older adults? Then you need to split that number of hours into 2 by 2, right? So that means the caregivers number is coming down.
Right.
And the service, they're getting less services than what they are getting today. Even 7 people spending for one person is a big problem itself. Right. But 3 people, can they really spare 9 hours of time or 8 hours of their personal time for an older people? It is impossible. That is a human cannot do. No matter how much close you are to the person, but still you have your personal life, and you need to feed your family, your direct family, like your wife, your kids, and things like you have to take care of all of the stuff. And that the technology is the best choice we have, and the technology can definitely assist the older people by monitoring, by listening to them, by asking if they need any help, in a couple of responsive ways. Can does.
Beautiful. I think the way you brought up this question of about how you are providing elderly care and how much amount of people are needed, whether it is 3 people or 7 people, and how much amount of time is being needed. And when it is a closer person, I know you're able to spend time. And in some situations, I think we see people are not even available, so people are far away, and then
Right.
they have to rely pretty much on other senior care uh, places or
Care
assisted living
facilities.
places. And so this is where I think, like you mentioned, technology can play a big role, and obviously AI can play a big role. So now, talking about, I know your firm. I think you started your firm, I think, like you mentioned, a few years back, and then you started building some solutions, right? Can you elaborate on what kind of uh, maybe a 10,000 feet view or a 50,000 foot view of about AITCare? What do you guys do? What do you folks do? What kind of AI powered solutions you're offering to prevent predominantly, like you mentioned, accidents or memory loss, right? I think that is one thing you wanted to start with. Maybe you can start with that, or if you can even give a higher level picture about a 50,000 foot level picture.
Sure. We started our company in 2022, January.
Mhm.
We started initially from the Ann Arbor, Michigan. That's where I am from.
Mhm.
And I moved to San Francisco in May 2022, within the same year.
Right.
Within 5 months of time, we moved to San Francisco, and we built the team here with one scientist, and then the technology team. We placed it. We also have operational team. We used to have that's in India. So our main thing is actually when we started, we have a very clear picture that what kind of work that we are going to do and how we are going to do. That's a clear picture. The work that we are going to do is to help the older people,
Mhm.
and how we are going to do is the AI. We have very clear picture on that one. And initially we started with fall detection.
Mhm.
We have seen. See, we are a startup company. Targeting the ADRD initially would need a lot of knowledge, the expertise, and
Mhm.
you need to have a strong team as well, which is actually in the beginning coming from Ann Arbor to here, which is a
Mhm.
bit difficult to form the team. And the financially, the savings that we have is limited savings. We need to use that. A family, friends fund, we need to use it properly.
Mhm.
So we didn't start the ADRD. So what we did, let's first build the models to detect the fall, and then we
Detect the
start
fall. Detect the fall of the. Okay.
detecting the
Can you
fall. The
explain a
falls
bit more on that? Yeah.
yeah, the falls accidents are actually close to 4 million accidents are happening every year in the US.
Okay.
So, and just the Medicare is spending close to $55 billion.
Wow.
Right? Forget about out of pocket is an extra money, right? Out of
Extra
pocket
money.
is a different thing. The Medicare is spending $55 billion just on the accidents. But again, once someone has an accident recently and then they went to hospital, so the average time once they get back to the hospital, the average time they're living 6 months to 12 months of time.
Mm.
So after the accident, they couldn't walk, they couldn't do anything. They're more depending on the caregivers and the family members and the other resources. So that's a big issue, right? And average time to detect a fall. This is another big problem.
Okay.
Average time to detect a fall is 12 hours of time. So let's say there is an accident happen, and to someone to come and see the accident to
Mhm.
to and it is taking 12 hours of time, because let's say the accidents are happening in the evenings, most of the accidents, and
Right.
most of the accidents are happening between the bedroom and bathroom.
Right.
So that means it's a very private space,
Right.
and
Right.
during that time nobody will be there, no caregiver,
Mhm.
unless the older adult living with the family members.
Right.
Even if the family is looking have bigger spaces, separate bedrooms, the privacy things, and then it's very difficult, right? So
Mhm.
what's happening here is the average time to detect the fall is 12 hours. During that time, the elderly person is going through a lot of pain,
Okay.
physically and mentally, right?
Mhm.
That is actually biggest failure, right? So that's where actually intelligent systems are coming. AI can, if you train the model, AI model, what is a fall, what is not a fall. So whenever there is a fall happens, it alerts the people. It alerts the whomever, whatever it is. It can alert the company, AITCare, saying there is a fall, or it can alert the caregiver, it can alert the provider if the provider choose that option, or the family
So
member.
are you providing some kind of a sensor that is built into these tools and these technology through AIT, or how are you detecting the fall?
So the fall detection, actually, the first solution which we implemented, and that started working 2022, and it's until 2023, late 2023. So this is completely cloud-based solution. So that means we will have our machine learning models on the cloud,
Mm-hmm.
and entire infrastructure will be on the cloud. And there is RGB sensors, which is basically a camera, we call, right? The camera will be going inside their home, anywhere on the wall or the ceiling.
Okay.
More one or two cameras will be there. So it depends on the size of the room and depth of the room. Uh, so these cameras, it's any IP camera. This is not a specific hardware. You bring it, anything which is an IP camera, which can stream the data to the cloud, and bring it on, and that's streams the data and then sends it to the cloud. That's our solution. That's our solution. So we started selling the solutions for the facilities. So answering your question, yes, we have RGB sensors.
RGB sensors. Okay.
But we don't manufacture those RGB sensors off the shelf, which means anywhere you go and buy it, Amazon or Walmart or anywhere, you bring it on, and then stick it to the wall, and then configuration changes. We provide those instructions, make those changes, and then it starts streaming the data. So that's simple, actually. It's more of like plug and play.
Plug and play. Do you tie up with any of these primary care hospitals or caregiving locations, or maybe even residential or commercial properties? Or is there any kind of tie-up, or is it like a directly purchased by the consumer?
Oh, this is not a consumer product. This is B2B, completely for the care
B2B.
facilities. We built it. We do not have any partnerships with the hospitals yet, and we do not have any plans to go there anytime near for the fall detection model. So, but the care facilities, yes, we do have a couple of care facilities. We are partnering with them, and total we have 7. And currently, actively, our devices have been deployed in 4 places.
Okay.
Yeah. So they do the same. Like we look for the high internet speed, because the more number of cameras, the more the speed that you need in internet speed. And we provide, basically, we give them the cameras. We buy it from the Amazon, and then we send it to them, or we ship it to them directly, and then we provide the instructions to them. So that's how actually majority of the installations are done.
Okay.
Yeah.
So from AITCare standpoint, you folks emphasize more on visual cues, auditory cues, and also verbal cues in your approach, right?
Right.
So can you explain how these cues work together to provide the effective elder care? Maybe you can pick up a particular example or a use case, and then maybe we don't need to go into the confidentiality information, but can be, maybe you can, if you can anonymize a particular scenario, and how all these verbal, auditory, and visual cues work together, and then if you can explain, that will be helpful.
Yeah. So as I said, the AI has a better senses in many cases. Like it has better listening skills, better vision skills, better communication skills. So we named after cues. Basically, these are actually based on these 3. AITCare is actually built on, literally. So right now, focus mainly on the vision side. So what is, when we started of this, I can talk more about vision right now, because that's what we are
Sure.
actively working on. The auditory and all, I'll give very high level. So vision is actually, if you can understand someone's ADLs, activities, daily living, then you know the pretty much most of the health information of that older people. By the way, ADLs, instrumental ADLs, it's called ADL, IADL. So this term will be used for the older people. So not generally we use it in outside, but this terms has been used for the older people by the caregivers, by the doctors, the hospital premises, things like that. So if you can detect the ADLs, activities, daily living, or instrumental ADLs of the older people, then you have pretty much most of the data of that particular person. So what do you do once you have the data? You need to check the data. What is the data and what it is giving that information? If you can read that information from that existing data, then you have their health report, complete health report. So that health report can have the present health to the future health as well. So that's what we do. So by using the vision models, we collect the data of the ADLs and instrumental ADLs from, let's say, sleep diary, and then sleep wake disorders. You can predict, based on sleep diary, you can predict the sleep wake disorders. Based on their other ADLs, like sitting, standing, walking in different areas. You can predict their cognitive health. So this is pretty much actually how you read the data and how you get the right information from the data, and how to how do you do the predictive analysis. That's all matters here. So yeah, we using our vision models, we currently doing fall detection. We are also doing the fall prevention. That means fall prediction. We do the fall prediction. Okay, this person might have a fall in near future. It's a completely purely prediction. It is nothing a guarantee, but it's prediction for now. Maybe eventually down the line.
So you send some kind of a signal or something like that. If you think that there is going to be problem with this particular person, you are predicting something. So a signal will be sent ahead of time to the assisted care facility, or how does it work?
Right. So basically, this is something I missed in your last question. So if the fall happens, immediately we take a short video of that fall. And then we store it in the cloud systems, and then we send a link to the caregiver. And the caregiver, when the caregiver gets this notification, it says SNS. It's over cellular. We are sending it.
Right.
So when they click on that link, they'll see the fall. At that time they'll be judging that whether this is a fall or it needs immediate attention or doesn't need an immediate attention, and that they can make that call from there on. That's a fall detection. Fall prevention, fall prediction said what we do, we predicted unless if there is a serious abnormality in their behaviors or in their activities, we don't really send notifications in the fall prediction side. So, but we collect the data, and then we run the predictive analysis using our machine learning algorithms. And then whatever outcome that comes, right, we are sharing with the caregivers or the family, or could be provider, could be a professional caregivers. That's what we do in the fall detection and the fall prevention side. Yeah, I hope you answered your question.
Sure. Yeah, no. You gave a very good, complete, holistic view of how these things happen. And since you are already very closely working with these assisted care facilities and other places, you kind of, I know there will be some kind of issues related to data privacy and other aspects. How are you? I know you are maintaining all this HIPAA standards and other things. Do you want to talk a bit about that? So, because people generally feel that how do you store this data? How do you analyze this data? And when and where it can be leveraged? Maybe a few thoughts around that.
Yeah, sure. Yeah, as you said, we do go by the HIPAA guidelines completely, 100%. And there is a couple things that we do, but I couldn't talk here. But other things, whatever I can talk, I will discuss. So basically, we don't disclose the identity of that person. So we have different models for that. When we are sending a video, we mask the person completely. We don't show that the physical person. That's because of we want to protect the privacy. All we need to convey the caregiver is there is a fall, and here is the fall details, right? They really don't want it to see the entire physical what they are wearing. It's all irrelevant for that context. So when we are sending a video, we send the video with by masking the person so that the identity will not be disclosed. Even for certain different reasons, by mistakenly, if the caregiver is sharing this link with somebody or whatever reasons, or downloading accidentally, we are preventing all of this. But even let's say it happened in 1% cases, but still they cannot see the person, who the person is. So that's how actually we are protecting their thing. The visual data will never be, going out, first of all. And on top, the whatever the ADLs, health-related data that we are capturing here, everything goes with the HIPAA guidelines there. And we will be having BA agreements between the businesses. We have a complete team of people in the US by trained on the HIPAA guidelines. HIPAA trainings has been taken. So that's how actually we are protecting the consumers' data.
Beautiful. I think this is one of those great solutions, right? I think we talked about the visual aspect of it. Do you also want to briefly talk at a high level about the other aspects of the auditory and the sensory aspects of it?
Sure.
Before, I know we don't need to go into the details because you are currently focusing more on visual. I know, but what are the thoughts? Or where are you journeying in? Because that is where it's going to come, right? I think eventually.
Right. So the auditory is more of like, there are remaining two senses that we making use of to predict the preventive care, to make it better preventive care, is by listening to them. So what they speak, what they say, are they in a pain? So think of it this way: if the person is living alone and no one is around, but still they're talking, there is some behavioral change that happens, or maybe they need immediate need of help. And since nobody is around, if they're feeling pain, and then they express the pain, if they need help, they'll express the help. They ask for help. So if there is no resources that can listen to, then it will be you're not really providing the service there. If you look at Alexa and Hello Google, and these products are already been proven that these products are helping many people, not just the older people. It's also helping with the people with the disabilities, people, the pregnant women, and the older people, and many people, right? So that is one of the best example cases that we can do. So by listening to them, we can provide the help, and by talking to them, by having a conversations with them, we can definitely make them better mental health. So they need the conversations. They need conversations to be started. At the same time, you can also ask questions like, do you need any help? Do you need water or prescription? I think your reminder is this: hey, you need to take the medication at 9 a.m. Have you taken Mr. George, for example, right? So those kind of reminders you need to put in. And why do we have to do these things? It's because they have a frequent forgetfulness. That's the biggest problem, is actually frequent forgetfulness. If they don't know when to take the medication, or if they forgot when to take the medication, somebody has to remind. Like whatever human can do, the AI can do here. Then they'll go and get the medication from there. So by seeing, you can understand most of their health conditions, like visually what they're doing, how they are doing. By listening to them, you can understand. By talking to them, you can understand their health. This is the science is saying, the history. If you look at history closely, history was also showing that these three parameters, we can use these three parameters, high level, looking at the person, talking to the person, listening to the person, you can provide solutions for their needs. In this particular case, AITCare is focusing on elderly people health. So these three parameters are much needed on this. So that's what we do. Down the line, what we do with the auditory, we have certain very high level of idea, but we might change those ideas to, we might pivot it to something else. But right now, everything is very, very high level. So there is no point even if
Sure. Sounds fair enough. I know you guys are like there maybe for the last 2-3 years, and you said that you've already started working with some of the assisted care facilities.
Mhm.
Any particular improvements that you could see in while using your products or your services solutions, which has improved the quality life of the seniors, that you could explain like how it has improved? I know you talked about the prediction capabilities and also the fall capabilities. Once the fall happens, you're reviewing it, but you're also doing some kind of preventary mechanisms, right? Did you see this already in action, or did you kind of get some kind of feedback on that already?
Right. Yeah. Yes, we do get a case study. We have a case study, which is basically it's prevented the falls.
Okay.
So basically, the customer asked us. The customer was having a case, which is the older adult woman having frequent falls.
Okay.
She fell, I think, 3 times in the past before started using our product for that older. They were already having our cameras, but not for that older person.
Okay.
So when the case, frequent falls are happening, they asked us, the important question they asked, you good, you're detecting the falls in other cases.
Right.
But do we know the reason why she's,
Oh,
falling?
right.
Is it stripping or different dizziness or something? Because their floor is very flat. Right?
Okay.
They don't keep bigger objects, but they wanted to know the proper reason so that they can prevent the falls if possible, right?
Mhm.
So what they asked for the product, and then we deployed our product at their place. The interesting behavior is actually strange behavior, I would say. She was not sleeping in the night times.
Mm.
She was not sleeping in the night times. Rather, she was standing at the window and looking at in the window whole night,
Mm.
pretty much whole night. She's going to bed early morning at 5 or 6 a.m.
Oh, okay.
So the whole night she was actually most of the time she was standing. So how do our models detected these things? We collect the ADLs as I mentioned, right? Sitting, standing, walking, bending, anything that they do, and sleep diary. We collect these things. If she's not sleeping, either she has to do other rest in any of these activities.
Yes.
And so this is a closed room in the night time. So definitely she has to be inside the room. If she's
Right.
not in the room, our AI systems knows that she's not presented.
Okay.
And after some time, it alerts the caregiver saying that the person is not presented because they expect the person to be in the room or in the facility, right? So if we don't see for certain time, it get they send a notification. We send a notification to them. So in this case, we have seen she's standing for 6 to 7 hours in the night time, just between the 12 hours clock. You see,
Right.
6 to 7 hours, which is the biggest problem.
Right.
And the mornings at around 7, 8, she's having the falls.
Okay.
And that's when actually the customer changed the pattern. Now they changed the treatment, and now we never heard any falls happen. But in that case. So that is actually one of the best case study we had so far. But in other facilities, the falls has been reduced, and fall detection. So far, we got only one fall detection alert, and the data what we are providing to these caregivers is what's their ADLs level, how long they are sitting, how long they are walking, how long they are doing activities. So if they see anyone who is sitting for 10 hours time, they have a very high probability that they can have a cognitive decline in next near future, in few months or few years time. That's NIH publication basically. Right? And the moment we have seen this, one of the example that the person is sitting for 10 hours time in a day, not straight, may not be straight, but then straight, but 3 hours and taking 5 minutes break and coming back and then sitting for 4 hours. Right? So that's things like that. So 10 hours. We have seen an article that has been released from NIH says that a person is average time if anyone sits for 7 hours, then they'll have a high probability of having a cognitive decline.
Okay.
So this kind of information is very important. So, and this information you cannot, even if you keep a human right next to the older person 24/7, imagine you're keeping three people 24/7. It is impossible, to remember those activities.
Yes.
And either you cannot record them too, unless you have a super intelligence like AI,
Right.
collects the data for every second or every 5 seconds.
Right.
So that's why the human solution is not feasible here. Even if somebody is having and can afford all these services, but still, unfortunately, they cannot get this data, important data. And this is where actually we when we are presenting this data to these people, we caregivers or the facility admins, we present this data in such a way that they'll understand quickly. And it doesn't matter how we retrieve the data, but we have to frame it in such a way that they can understand the data. Hey, this is what it is happening, and this is what NIH is talking about, and this is what we have seen. So I think you need to pay attention to this case, this particular older person's scenarios. So that is what actually we do.
Okay.
Right, yeah.
Beautiful. I think that's these are some very good examples that you gave. I would now pivot this and come to an interesting question, or the XTraw AI question that I call, whether it's $1 million or $1 billion question. I know in a growing market of AI healthcare solutions, how is AITCare setting apart from its competition? I know there is too many solutions out there. I know the healthcare AI space is just about starting up, with a lot of these technologies out there. What do you see, or how do you see yourself differentiate, or maybe that uniqueness or unique factor that you have?
Yeah, that's an important question. Yeah, I agree. There is a competition, but there is not much competition compared to the other sectors.
Okay.
The elderly, in elderly market, there are very few companies are coming. The reason is actually it's hard to survive.
Right.
It's very hard to survive. It's hard to sell the technology to the facilities or the older people. First of all, they don't know the technology. Most of the people are unaware of the AI, what AI can do, what AI cannot do. So they are hard to make the decision. The second thing is most of the facilities are already having, some kind of solutions right now. They're not proper solutions, but they acquire the solutions. They have contracts with those solutions. So it's really hard to adopt a new technology for those people. Yes, competitors in fall detection, and there are two companies which I can name after. Those two companies are actually started a couple years back. One company 9 years ago, and the other company is 5 years ago. One is in the Bay Area, right next to my apartment, literally. The other one is actually Switzerland, but they moved here.
Okay.
So they do the fall detection. If fall detection happens, they pretty much convey the same thing, like caregiver the information, but the accuracy matters. So I'll give you one real-time example. Recently, we spoke to one of our potential customer. I can't name them. Last Monday. So as per them, this one of the competitor that I talked about, it's not giving right accuracy. Basically, it is also giving the false positives.
Okay.
So, and the installation setup and all very huge, complicated things. So you need to drill the walls. You need to, put some objects, bigger objects on that one. That's another thing. The cost is another factor that plays. to deal with the competitions. And if you're looking at these things, we are not really focusing on. I'm giving the straight answer here for you.
Right.
So I'm not really focusing on the people who can afford. I'm focusing on people who cannot afford the technology today. So that means our research was actually telling that there are two what you call African American women and then Hispanic women. I'm just giving this as a very high level example.
Right.
African American women and Hispanic women, they have more inclined to the cognitive decline.
Okay.
So the cognitive decline that happens between these two compared to the other races is much higher.
Okay.
So we scientifically, I mean, there are many reasons that you cannot change in certain cases.
Yeah. Yeah.
But these people cannot afford. So then what? How do governments can support them? And the government is maximum number of hours it is giving is 9.5 hours time of the service. And beyond 9.5 hours, there is 2/3 of the day, night, right? They need the services too because they have memory loss, things like that. And the Medicare cannot do that, or neither Medical or Medicaid, they cannot do anything beyond that, those hours. So our focus is actually the people who cannot afford the technology, make it available for them. So that means you need to build the technology so that will be accessible to all the people, no matter whether they can afford, whether they cannot afford, they should still be able to use the technology. So that's a smart way. So if the pricing model, if you see, we were optimized our models compared to 23 and then 24. We optimized the models, and that is bringing costs down, way down. I'll give you 10 times down compared to the competitor and our price. We are charging 10 times less than what our competitor is charging today.
But still, you're not directly serving the consumer, but it is always a B2B. In that
B2B.
way, you're covered. Okay, got it.
Okay, facility. But even in B2B, let's say you own a facility with 100 beds, size of 100 beds, right? So when we have a contract from you, we are not selling all 100 devices to you, or you're not asking for 100 devices. But what we only tell them, if you think you need the device for that older people place, just use it. Take only those number. Let's say you find the requirement for 50 people. The remaining 50 people doesn't require, doesn't need the service, the AI service, or they don't want the service. In either cases, you don't really have to use the 100 because we have the contract, but you can go with the 50. So you are paying only for 50 devices, the 50 licenses that you are using every month. So that's a cost saving for a facility.
Right. It's a great conversation, Ravi. I know this is a very, you're actually working on one of those problems which are very tough and also very close to the heart for many people. I know a lot is happening out there. What do you foresee in these kind of AI applications for elderly care in the next 5 to 10 years? I know the field is evolving rapidly. Healthcare related AI technologies are also getting in there. So what do you think is going to happen in the elderly care and how AI can take over the next 5 to 10 years or help in the aspect? And what is the key message that you would also like to give it to the audience regarding the integration of AI into elderly care or healthcare and elderly care? Maybe these two questions, if you can answer, I think.
Yeah, sure. I mean, if you look at the trend, everyone talks about AI, right? Everyone is trying to do something good by using AI.
Right.
And AI has that capability. AI definitely has the capability. We specifically talk about the older people and their health, their services that they need. So we'll be hitting two problems. Even currently, we have two major problems. One is the caregiver shortage issue,
right,
and the cost of the caregiver. And the second thing, providers, the number of doctors we have is for the older people. The 70% of the resource utilization is happening for the older adults.
Okay.
You know this. The finances, hospitals, beds, doctors, nurses, you name it, right? The hospital, 70% of resource utilization is happening for the older people. The remaining 30 is actually mid-aged people, the kids, and other rest of the thing.
Right.
The same trend, actually, if the continues, the same trend, I don't think Medicare is going to have even dollar amount in their repository. Neither Medicaid or Medicare. Same thing with if they cannot do that, and then family has to jump in and then put their money to save their family members, their parents or their grandparents. So that is the disaster, right? So the specifically older people thinks the only solution that we have is a preventative care. You prevent before things happens, the worst things happens before it happens. Make sure you prevent those worst things. So that way you can give them the better health, better life, the quality life they can have. So Tesla is building a robot that's for the homes. They're literally building it for the homes. And their main focus is also for the older people.
Right.
Older adults. So they need services, and then these robots can cook, can talk, can lift weights. So things like that. They can give the bath, feeding, things like that. These robots, that's how they're trying. And there are many other robots are also coming into the area. But I would definitely doubt in next 5 years this is not possible. Because we are learning for 30 to 40 years, before we call it ourselves as a matured mind to give a care to somebody. So AI, again, it's a bit difficult, right? You need to train the models and then a lot of stuff. The more you train it, it becomes an overfit. So there could be a failure cases. At least they'll keep these robots for years in the testing for sure. Like, how we are seeing Waymo in California, San Francisco roads. We have been seeing it for the years, right? Still, it didn't go out, but it's still working. It's greatly, it's working within the city because they're still collecting the data on that part. So think of the robot. Do they put a robot inside the home with the 2 hands and 2 legs, where it can capable of doing anything at that point? The moment you give hands, something legs, it can do anything. It can run away from the home, or it can use the hand to, on the weapons, things like anything can happen. But yeah, so next 5 years, I don't think this robots will be coming. But what can come is better monitoring systems.
Better monitoring.
Monitoring systems are coming. Those better monitoring system can provide a better health reports, health records. The integrations can easily happen between the existing health records and then the new AI that is bringing in the data. So the predictive analysis would become much easier and much cheaper too. So that has been proven already. Most people talk about DeepSeek now. NVIDIA recently gave a keynote at Las Vegas at CES event. So the hardware cost is coming down and down, which is very good sign for AI. So the elderly people cases, yes, it help. The AI can help with anything, whatever the elderly people services that they need, getting up from the bed to the taking them to the bed again in the nighttime. So from the morning to the until night, can does anything. And during the night, one of our product, which is Sleep Diary, it understands their movements, their postures, bedroom, bathroom routines, falls. So all of this data can. So that means you have 24/7 monitoring systems there. And all this entire monitoring system is not an active monitoring system where human is sitting and then watching those older people. It is a passive monitoring system. And these AIs, it's non-wearable things. And another thing I wanted to emphasize here, between the wearables and the non-wearable has a huge difference. Yeah, I think I should call it as wearable and non-wearable AIs. AI and then wearable. Wearables, we tested, wearables, 3 different wearables on the same person for some time. And each device is giving a different data. Trust me, Each device has giving its own data. Like, one device says you have a REM sleep from this time to this time. The another device is saying that you have a deep sleep during that time, which is impossible. Which is impossible. How can a person can have a deep sleep at REM sleep at the same time for the longer time, right? It just doesn't exist. And the three devices we tested, even Stanford does the same testing. I think they
Right.
used a number of devices on the same person to see. So that means that's matter where you are putting that device wearable. Is it on the as a watch or as in a ring, or what sensors they are using it. So they all matters. So that means you cannot rely on the wearables anymore.
Right.
And when it comes to the older adult, their skin is too sensitive.
True.
Their skin is like a baby skin, right?
Right.
Simple pin touches, you will see the scratch, a big scratch kind of thing. Right? So that means you're not really getting the pulse from that older adult. So that's a huge problem. So whatever data that you see coming from these wearables, it's not right data. But I appreciate one thing that earlier, yeah, it was helping by looking at the trend.
Trend.
That
Yeah.
is good. Like, oh, the person is going to bed at 6 and getting up at the 6. And the trend is actually he is in a deep sleep mode for this time. It's a rough number, but it's still good, right?
Right.
That is
Right.
helping. But you need a better solutions than that.
Right.
Much better solutions is the AI is the better one. So if you can use the different sensors without touching the person, I think the person will have the much better health reports, health records. One of my personal example that I can give you is in 2012, I used to live in Ohio, state of Ohio. Uh, I couldn't sleep for 1 week. I
Okay.
don't know why. Maybe the food that I was eating, I don't know, for some reason, I couldn't sleep. So then I visited, I've seen the doctor. The doctor actually, I don't know if you're familiar with the polysomnography, which
Yeah.
is
Yeah.
your laboratory will be there, and then they'll attach a couple of sensors on your body,
Right. Right.
places, and then they'll give you a sheet, so you can fill that thing. Generally, whole thing will happen in the laboratory manually, except the sensor data. Everything is manual. At what time you're going to bed, somebody will come and take a note of it. And then in the morning, they'll come and take a note at what time you got up from the
Right.
bed. So, but in between any movements that is happening in your body, the sensors are actually collecting that data.
Collecting. Okay.
That's very expensive. You need multiple people, a laboratory, you need a doctor should be prescribing that one. You need minimum two visits, to see to get this test done, and you need to have nurses on top of it. So all of this, which is very expensive, the fact, right? So, but what happened was, in my case, they gave me a sheet because they don't have a laboratory, or the lab was busy for some reason. They gave me a sheet. They attached all of these sensors to my body, and then I went. I couldn't sleep, first of all, because anything touches my skin, uh, it's different in Uli, right? You will feel like there's something is attached, and on top of it, they gave me, I think, 5 or 6 spots on the body, back and the front. How do you sleep? And I'm a side sleeper, which is fortunately side sleeper, but still, if something is touched your body, which is a gel feeling, you'll have it.
Yeah. Yeah.
So how do you call that data as a real data, right?
Right.
You can't call it as real data. And if you are using the device for 3 months, now 6 months of time, maybe you got used to wearing those devices and then going to the bed, then it might give results. So the point is actually the existing results, what you see is polysomnographic and wearables and all, they are misleading in many cases. The doctors are in a big trouble that they don't have the data or right data. They're imagining or they're assuming that this data is the right data. Whatever data they already have, that's the right data. They are giving treatments based on the data. So that means the treatment is going in a different direction than what patient or the person needs the treatment for. But AI, this is where actually AI can play a bigger role. The non-invasive, no interaction required, monitoring tools will be actually coming more and more, and they does the magic. They provide the right data, right time to the provider. the patient doesn't need to go to the hospitals to see the doctor. Neither provider doesn't need to ask a patient to come and see for regular checks. But the AI in the middle collects the data and then translates it into the right format and then sends it to the provider, then saying that, hey, this is thing. Now the provider has the right data and then take the decisions.
Right.
And we have been testing the sleep diary for more than a year now.
Okay.
And it is, I wouldn't call my product is the best product for now, but we need, at least for next couple of years, we'll be training these models in different factors. But I would see the AI, the Vision AI is going to do the much better, monitoring systems will be coming in. So that's my prediction. Next 5 years, you will see number of products will be coming in, but the best stays in the market. The worst always goes down, and we wanted to be a best in the market for sure. And the second thing, my suggestion for the AI thing, right? Most people are actually building even Tesla. If you see Optimus,
right.
Gen 3, Optimus Gen 3, they're giving 2 legs, 2 hands, 2 eyes, and everything. They're trying to replicate exactly like a human.
A human, yeah.
And why do you have to do that?
I mean, you don't need.
Right. Yeah, maybe you are giving better intelligence. You don't really need 2 legs to walk. It's increasing the price. So rather give wheels, and you don't need 2 hands in certain cases. So rather than making another human robot,
yeah,
just make a robot which is actually fixed to a certain task. That means you need to divide that one into multiple things, and then make sure those robots are doing only that particular task. As I said, right? If you build the robot completely and then you don't know what that robot is going to do down the line, we have seen maybe tens of movies like this. Right? Like the robot is attacking something, doing something. All these robots has 2 legs, 2 arms, and then 2 eyes, things like that. Certain cases, you need more than 2 hands, but you don't need legs there. You don't need to give legs to the robots. And certain cases, you need more than 2 eyes. Right? Now what we do to see something behind, you need to turn your back, right? You have to turn around and see. But if you give the 2 eyes in the back, I mean, that robot doesn't need an extra setting.
Right.
The robot can do other side. So I think giving the particular task or training a robot for a particular task is cheaper, quicker, and for human safety. So you need to make sure use the AI properly. Don't make another human using the AI, or don't make another worst robo-human to impact this thing. It's always technology. How you use the technology is really matters. Right. If you use it excessively and for different reasons, there could always be a bad people, a good people, right? And bad people might use this robot for the bad purposes, bad benefits.
No, but I think you brought home a very interesting and a very important point, saying that there should be these task-specific robots which are focused on the task at hand. In that way, you can obviously provide and deliver under this regulation, and of course, controlled robots, as well as the cost can also be lower because you are focusing only on that cost. Some great piece of advice that you have given. I know we have crossed a little over 1 hour, but I think it's a fascinating conversation that I had with you. I learned a lot. If people would like to reach out to you, or what is the best way, or if they have to engage with you, any closing remarks or key takeaways that you would like to provide?
Sure. My email ID is actually ravi.kota, ravi.kota @ait.care. That's my email ID. And our website has all the details or contact information. Anytime they can find the email, phone numbers, but mostly I'll be available on the emails. Anything that you need, any way that I can help anyone to understand this market, AI market, elderly people areas. If any startups are coming in, they wanted to, some information, then I'm happy to help.
Beautiful. Thanks, Ravi, for your time. And I believe you guys have first launched in the US, and pretty soon you'll also expand in other parts of the world. Is that right?
Hopefully, our main focus is US market.
US market for now. Yeah.
Yeah, US market for now. The rest of the world is actually increasing. The population is growing, which is very good. By grace of God, people are living longer.
Right.
But the services are actually lacking.
Right.
Should be able to provide the services to the rest
I
of
know
the world.
countries like India need a lot of support and services, but yeah, that's a different conversation. I think maybe we'll get you on board for another detailed conversation. But I learned a lot, and it's a great amount of wisdom that you have provided. Thank you for your time.
Thank you so much, Raghu. It was wonderful talking to you.
And that brings us to the end of another powerful episode of XTraw AI. A heartfelt thank you to Ravi Joseph Kota for joining us today and sharing his inspiring journey from identifying real-world challenges in elderly care to building AITCare, an AI-powered solution that's making a profound difference in people's lives. Your vision and compassion, combined with the power of technology, are truly shaping a better and more inclusive future. To our listeners, thank you for tuning in and being part of this conversation. If you found value in today's episode, be sure to share it with someone who cares about the intersection of AI and humanity. We've got more exciting conversations lined up. So don't forget to subscribe and stay connected with us. Until next time, happy predicting the future with AI technologies, and stay XTraw